Welcome, everyone. I'm Dr. Suzanne Tang, and I'm a co-founder, licensed acupuncturist, and naturopathic doctor at Coastal Acupuncture and Natural Health Center. And I am so excited and honored to have Dr. Handy as our guest. We're doing these bi-monthly canned virtual talk series to connect with our community, to showcase a colleague that we respect and really believe that, you know, this is a village. Taking care of one patient takes a whole village. So we're so excited to have Dr. Handy as part of our village. So thank you, Dr. Handy, for being here.
Thank you. It's my pleasure and honor. I'm so excited to get to be a part of this and be interviewed by you.
Thank you so much. I'll give everyone a bit of your bio, because I know you have many patients who are here with us today and some new friends as well at the workshop. So Dr. Handy is going to be speaking about the benefits of biofeedback for the brain, heart, nervous system, and immunity. So I gave her a big job to do to discuss all of that. Hope we get it done in an hour. Dr. Handy is a well-known speaker, author, educator, an integrative medicine practitioner in Newport Beach. She has co-founded Handy Wellness with her husband, Dr. Jim Handy, who is a chiropractor. And the reason why I know Dr. Handy's, both of them, is that my patients told me about them. And they raved about Dr. Handy, Joqueta Handy, as well as Dr. Jim Handy, for just their amazing expertise and healing ability. And I just said, I have to meet these doctors. And lo and behold, they're right next door to me. When we used to be in the same building together. So I thought, oh, how serendipitous is this? Is that as I get to be part of a community with practitioners that are on the same page and really care about patients and have such wonderful tools to be able to help our patients. So Dr. Handy, thank you again for being here. I think, let me just make sure everybody is on. Wonderful. Thank you everyone for muting yourselves. And like I said, if you have a question towards the end, I'll open it up. You can unmute yourself or you can throw your question in the chat, but we'll get started with some questions that I have for Dr. Handy, and she'll be giving us a demo so that we can see what biofeedback is like. So that's my first question. What is biofeedback and how does it work?
Well, that's a big question. That's what they always say, you know, what is this thing? Because you walk in and you just see a device and you have some electrodes and they're like, how is that going to tell you information about my body? And I really think about it as, Dr. Ching, I mean, you're my doctor. You're my daughter's doctor. You know, when you walk in the room, you start reading people before you have asked them any questions. You get a sense of who they are. You pretty much nailed me on that. You know, I need to get more rest. I don't need to work as hard. I need to take time for myself. And that was all before, you know, I even said a word and before you did any sort of acupuncture. So we have, I think, as healers, as working with energy, we are able to sense that. Everybody's able to sense that. You can walk into a room and immediately know the vibe of the room. Are these, you know, oh, everybody's in a bad mood, or wow, this is a great energy. And so that's because we're just energetic beings. And that's all that biofeedback is doing. It's picking up on those energetic symbols, those energetic frequencies. And our body tells us when something is wrong way before blood tests can pick up on that, way before we may even feel the actual symptom of it. I've had patients get kind of upset because they'll come in and I'll be like, are you okay? You know, it looks like you've been exposed to the flu. 48 hours later, they'll call and they'll be like, I have the flu. And so again, their body was giving them those signs of stress way before they actually, you know, had the fever or overall body aches and pains. So that's all that this is doing. We're just putting on electrodes around on acupuncture areas around the wrist, the ankle, and 8 electrodes around the head. And it is just picking up on where are stressors in the body and then interpreting that stress response. So running it from head to toe and interpreting that response as this is most like, and dropping it into a category. I'm able to see that category then by color and by number. It's just the way the system orders the information. There's over 13,000 frequencies that are in the software of the program. And those are run through, I forget how many millions of, anyway, bits and bytes. And it can basically in about 4 minutes, we can have a result. And that result is then put into a digital report, which is just an average. So what that means is, like, if it's the liver, it's going to go in and it's going to pull all the frequencies that came up about the liver, and it's going to give me an average number. And then I'm reading that is, if it's over 100, that's considered reactive. And if it's under 50, that's considered reactive. The numbers below 50 are more chronic, and the numbers over 100 are more acute. But again, it's just picking up on many of the things that everyone, and especially, doctors working in the field, just like you, of natural medicine, chiropractic, like my husband, many times, I don't need to tell him what vertebrae are off. I like doing it. I like telling him how to do his job, but I don't need to do that, right? When he puts his hands on that patient, he's going to know the vertebrae that are off. But many times this will, if I see a patient first, it's going to tell me, you have cervical vertebrae 1 that's off. And oh, that's more than likely tied into why you might be getting migraines. Why your nervous system is off and you're having difficulty with sleeping, or why we see the body in a fight or flight response. So from identifying those areas, then we can make a kind of a, an all over, see the whole patient and put that in place with symptoms.
Well, what I love about, oh, and I think someone needs to be muted. Give me a sec here. If you're not muted, please mute yourself. Thank you. Otherwise, there'll be some interruption. So thank you. So what, I forgot to mention that I am a patient of yours and your husband's. And I'm
a patient of yours.
Yes, we're mutual patients. Yeah. And I have to say, you're both incredibly intuitive. And you do such an amazing job. I've come in hobbling in to Dr. Jim Handy, and he's got me completely pain-free. You've been able to tell me things that I've known that no one else has been able to pick up, really, unless they ask questions, they maybe really do the investigative work. So when I came in as a patient to see you, I was kind of just wondering what biofeedback was like. And I was amazed when you were able to pick up some things that were in the past, some past conditions that were still there. I thought I took care of it as a naturopath, or yes, it's something that's been chronic. So that's what I really am so curious about, the biofeedback, is that as a naturopath, sometimes even though I'm pretty intuitive too, sometimes there's certain things that it's just, I'm not able to detect it, without doing extra blood work and, very deep investigative work. So what I love about what you offer is that you're saying, there are things that we get into, our energy can get into an imbalanced state, and we don't even know it yet until it becomes physiologically, viscerally, organically, it's in our organ systems, it shows up as imbalances. And then at that point, it takes a long time to heal those systems. So what is so interesting about what you do is that you're able to pick it up very early on and then tell patients, hey, these are things you can do preventatively, or your system is out of balance. Let's start working on it now so that we can prevent issues from happening down the road. So correct. I think that's really important, because we, as naturopaths, we really focus on, prevention, and acupuncture, as acupuncturists, we work on the chi and blood flow. So it seems like it works together very well. Yeah. So tell me about, specifically for, I wanted to talk about how the biofeedback works for the brain, for anything that's going on for the brain, the heart, the nervous system, and the immune system. And so it sounds like it's an assessment tool, but can it also treat conditions, or does it tell you what kind of gives you information about how to treat imbalances? Specifically for those.
It does it, well, yes, it kind of does everything. The FDA does not like the word treat, so we have to use the word train. So what we are doing is we're training the body, which I think is a really good word, right? Our body has an amazing ability to heal when we set up the right environment for it to do so. So when stress is eliminated, when we have the right nutrients, whether that's from our food, if that's from supplementation and herbs, the right exercise. So yes, and in answering your question, does it tell us what is the solution? How should we go about fixing this? Yes, it does. It's taking pieces, identifying pieces, and bringing them together for in the whole puzzle, in the whole patient, looking at the patient as a whole. And specifically with the brain, that's one of the areas that I enjoy the most. I think just, in 30 years of working with autistic children, they were the ones who brought me to this device. And it was, how do that gut brain connection? And the way that this information was divided up, just kind of categorized, chunked, it helped me see it so well of the whole inner workings. So looking at neurotransmission, so those hormones that convert to peptides and work with our nervous system, both in our central and our autonomic nervous system, seeing that chunk of hormones. Then looking at what are just the stress hormones and seeing that loop. And seeing just male and female hormones, looking at it from in those different categories, the autonomic nervous system, what's going on in the limbic system, that fight or flight response, and being able to see that in pieces, but also as a whole, particularly working with autistic children was just so helpful. Being able to see in my background, my master's is in speech language pathology. The area that I've always enjoyed working with is language processing. What are our strengths in learning? And again, I had assessment tools that I could use in standardized testing, but sometimes standardized testing, especially with the autistic population, isn't normed for them. And it isn't really accurate, and it doesn't show their strengths. And so in using biofeedback, I was able to identify, there we see that auditory piece in the temporal lobe of the brain. We're seeing word finding problems because Wernicke's syndrome is coming up, Broca's syndrome, Broca's aphasia is showing up. Look at the cranial nerves. This shows us why we might be seeing apraxic-like speech, an inability to form words, maybe even nonverbal. So it gave us, not that I couldn't, just like in natural medicine and acupuncture and chiropractic, it wasn't that I couldn't put my hands on those children and figure it out, but this was gave me confirmation as what I was seeing, and it also I was able to track that full loop. How is this affecting this, and that full picture again, which was really helpful. And the same thing if we break it apart in the heart. Autoimmune is super interesting because there's many factors that can filter into that toxicity, fight or flight, nutritional deficiencies. So able to really back into it and say, what is yes, we have this diagnosis, but why? Right. And so many times I think that's what either from a time aspect in Western medicine, from a testing aspect in Western medicine, we don't identify the why. And I think that is one of the number one most important things.
Oh, I think that's great. I mean, that's really in alignment with naturopathic medicine as well, is that we look for the cause and we work to treat the cause. And it sounds like you found a tool. Like I use tools such as, stool testing and hormone testing, um, outside the box testing to confirm what I'm thinking is going on with the patient. And I really believe it helps the patient see, or the client see, hey, this is confirmation for you too, to do the work, to heal your body. So I did want to ask, you mentioned about the autoimmune system. What I do oftentimes look for is our viral infections that upregulate the immune system. Do you find that finding as well, Dr. Handy, when you're testing your patients?
Absolutely.
Yeah, okay.
Yes.
Because I do see that a lot via the blood test. As well. So I think it's great to be able to, again, think outside the box and really get to the root of the issue. Because we oftentimes, there is a Band-Aid approach where, let's just cover the pain, or let's suppress the immune system from generally, if you're thinking conventional medicine. And I do believe we can all work together integratively, but to be able to utilize the different strengths from each, each tool that we have is so important, each school of medicine. That way we can all work together and, like I mentioned, be the village.
Exactly.
Yeah. Okay. So you talked about the brain, especially with your patients who, your autistic, the kids with autism, you said really led you to look for other ways to help support them and assess what's going on. That's great. And then the heart, give us an example of, have you seen patients with like heart disease, cardiovascular disease? I tend to see a lot of patients with high blood pressure, which is definitely an autonomic nervous system issue, in the flight or fight system, kind of overstimulating the nervous system. But what kinds of conditions for heart disease do you find is very responsive to your treatments?
We had one just this morning. So right within our office family, a family member that was hospitalized, rushed to the emergency room yesterday for congestive heart failure, and had a heart history, but the doctors were, didn't really, were looking at just medicating. And what showed up is a very saturated diet in processed foods and white sugar. So high toxicity level, undiagnosed diabetic state, what I consider a diabetic state. So in addressing those, rather than just putting a Band-Aid on it with a medication that I think is going to cause this 84-year-old woman not to last very long, we can really back it up and say, I think even if we go to like Plant Paradox, Dr. Gundry, what did he say? He walked out of Loma Linda Hospital because he said, I realized if I taught my patients how to eat, I didn't need to operate on them. And so many times with our whole body, but especially with the heart, I see it very linked to over medication and also a high toxicity level, usually related back to the diet, a very poor diet.
I see. So like, are you seeing a lot of inflammation with a processed diet and high sugar? Okay.
Yes.
Yeah. Yes. And I think that, we work so heavily with nutrition and diet, and for the most people do really well, right? But there are some people who have such a, have patients who struggle because maybe there's comfort eating involved. Perhaps it's they're busy and they're wanting to go through the drive-through. So many reasons that keep people stuck in their own safe habits. And I know change is very difficult for some patients, but do you find when you give people the information, your clients the information, okay, you're having congestive heart failure because of, excess sugar, excess processed foods, creating inflammation, toxicity, does that kind of, wake them up and get them really inspired to make the shifts?
No.
I wonder if you have some kind of magic. to get people to shift. I mean, you really have to want to do it. You have to really want to do it.
Yeah, that's I think that's when I have to, like, stifle my own frustration, because yeah, I've had a large majority of patients, when I'll say, here's what you need to do, and they'll be like, no, I'm not doing it. I want that magic pill. And, or I tell them how long it's going to take for the body to heal. And they're like, I don't want to wait that long. And I'm like, well, how long have you been in this state? Or how long do you think it took you to get to this point? We're not going to fix it overnight. And I've literally had patients say, no, I will not do it. And I'm like, okay, then why are you here? No, I just, we always tell my kids there's a solution to every problem. So I try and approach it that way with my patients. Okay, let's try this a different way. This isn't going to be the best way, but any change is good change, right? If we're making steps forward, that's great change. I wish I had more patients like, Lauren, where when I told her, here's what we need to do to clean it up. And she was like, I am a great student. And she was, she did it 100%. And those are the patients that reap the reward. So I wish I could have my patients who have made those changes. And when they come in and say to me, I never want to eat any differently. I feel so amazing. I never want to change this. Then I know, okay, we have reached a lifestyle change. And I'm not, 2 years from now, this patient is going to still be doing well. 5 years from now, they're still going to be doing well. Right. So I wish I could have them come in and talk to the ones that say, no, I'm not going to do it.
Maybe we need to have a workshop like that.
I think so too. Yeah. Or like with the congestive heart failure patient, she told the doctor that she wanted a Diet Coke and a pizza. I'm like, oh, okay.
It's, you know what? It's a choice. I've learned as a practitioner that I can provide the resources, be supportive, and be a guiding light. But I always remind my patients that this is a team-based approach. Really, you're leading the way. I'm here to support you and cheerlead you. And there are some patients who are ready, and then some patients who aren't ready. And I think that there's so many complexities to having habits, and I do believe food can be addictive. I think, certain negative habits are basically keeping some of our patients stuck, and that helps them feel like, okay, I just don't want to deal. And that's, I think I got to a point where I'm like, I'm just going to embrace you and hold you wherever you need to go. And Dawn Summerford is a fitness trainer. We had her on a few weeks ago, and she said every step and every bite counts, and you're totally correct. It's true. Small changes make a huge difference. And when patients start to feel better, with that small change, they're willing to do more. But I think sometimes a lot of change can be overwhelming. So I try to break it down and like, okay, let's focus on these few steps. But when you see the shift, it's so amazing. It's why we do the work, of course. Yeah.
Yes.
So thank you for answering that question. I think in light of COVID, I know we're not allowed to treat COVID, but I wanted to have you just touch on how biofeedback addresses immunity and how we can support our immune system, especially during this time as the flu is going on and we're in a pandemic.
Sure. So there are 42 frequencies in the system that will recognize COVID exposure. And it very much divides it up. Is this a SARS exposure? Is this, COVID? So far, I'm running about 98% accurate with identifying that in patients, and then patients who have tested positive. And it was interesting, when when we were in the thick of it, seeing a patient who probably absolutely had it, but I knew based just on the numbers I was getting back that they weren't going to test positive. So those were the ones that I really worried about the most, and just supporting their immune system. So one of the things that we can do that served me very well over the years is biofeedback. We can test medications, we can test supplements. So it's done through what would be, in a hands-on approach, muscle testing or kinesiology. I'm terrible at it. I doubt myself too much. And so the machine, the biofeedback device, will take over. It'll take the human side out of that muscle testing piece. And so it'll say, this is what's in zinc, and here's what you need. So when we have that patient up on the screen and we can see their profile, it's called their matrix, it'll do a one-to-one analysis, and then it'll give a percentage of need. So let's say it says zinc, zinc is something that boosts the immune system. It was very much talked about as being a preventative tool against COVID, raising our overall immune system. So let's say that we go in and we say, okay, I'm going to, does this patient need zinc? We can even test specific forms of zinc. And how much would be helpful? Is it 50 milligrams? Is it 100 milligrams? And certain brands are in the system, so I can even do that by capsules. If I'm pulling up, let's say, pure encapsulation zinc picolinate, and I can say, are 2 capsules per day needed on that particular one? And it hasn't failed me very few times. Most of the time what happens is I go around, I'm like, I'm not doing that, or I'm not giving that much, or something like that. And that's the only time when it hasn't been beneficial. Same thing with medications. We're able to test those, and that's been very helpful in, over medications or things. Again, if we're going to test with COVID, going back and saying, is this actually going to be a helpful tool in boosting the overall immune system?
That's great. So it gives you really exact information on what type of supplement dosage resonates with the patient the most. And I'm sure it varies with every single patient.
It does, yes.
Yeah. And I agree. My muscle testing, I doubt it a lot too. So it's great to know that there's a tool that has such high accuracy and gives, a much more, a direct map, as a treatment map as to what the patient needs. I have a question about allergies, because I do feel that, it's so hard to identify allergies sometimes. I have some patients that have maybe some swelling and, they're not sure whether it's food or environment or mold. So does the biofeedback assessment tool also pick up on allergic reactions as well?
It does. So there is, on the digital report, I think there's about 50 different allergens on there. So it will tell us if, it will look at it in 2 ways. So let's say that somebody has a dairy allergy, but dairy's not in their diet. So it will show that. It will show it as a below 50 score. So I'll say, it looks like you're sensitive to dairy, but you're not using dairy in your diet. Is that accurate? Yes. It looks like you're, one of the ones that I see so many times, and I think trips up a lot of people, is you're more sensitive to what's in the food than the food itself. So we see preservatives and additives. And that'll be, let's say 140, 150. So you're getting additives and preservatives. One of the biggest places that trips people up are in the box, the prepared salads. And they'll be like, no, I'm not eating, fast food or processed food. Are you eating any prepared salads? Yes. Okay, well, you're getting them there.
Yes, I remember reading an article about how, like, soup plantation, it's no more because of COVID, but had so many preservatives, and people feel like, I'm eating healthy, and you totally are, you're eating vegetables, but there's also so many preservatives. So that's a good point. I forget about the packaged salads too, can also contain preservatives. So yes, it seems like it takes out a lot of the guesswork, the biofeedback tool.
Yes, it can be helpful, again, just in letting us, confirming what we already are sensing, or looking at something. I mean, I think the largest majority of patients that I get is, I'm kind of a last stop. We we've been to all these doctors. Nobody can figure out what's going on. Can you look at biofeedback and see what might be popping up? And had very interesting things come up from that. Just the other night with my father-in-law, who's 92. He's been having severe constipation for like a month and a half, driving my mother-in-law crazy. And so the other night he said, can you just take a look and see what it is? And we had no idea the medication. We thought he was taking 2 medications. Turns out he was taking more than that. And it came up that it was when I brought up intestine, did a cross-reference, and it said barbiturate. And I'm like, what barbiturate? What are you taking that's a barbiturate? Turns out he had been taking this sleeping pill for a very long time. And just recently, his doctor had told him to double it because it would increase his appetite. Never heard of a barbiturate increasing your appetite, but that's what he was told to do. Looked up the medication. The very first side effect was serotonin syndrome causing constipation.
Oh, wow.
So, it wouldn't have been something that I would have, with his, constipation, I would have gone down a complete diet route, taking him off of all dairy and that type of thing, which I don't think he should be on anyway. But anyway, that wasn't the problem. And I would have taken away his Greek yogurt that he loves to have for breakfast every morning.
Right. I do forget that I do need to do a really complete analysis of patients, medications as well as supplements. But, so many elderly patients are on a slew of medications, and there's interactions amongst them and side effects. So, wow, that's so can you finish the story? I don't know if he's better now that he was he weaned off the barbiturates or?
Well, unfortunately he's taken it for a long time. So he went cold turkey, didn't sleep.
Oh, no.
Extremely gripey, and that made it worse for my mother-in-law that we were trying to make it. So yes, we're going to have to do some work, to wean him off of this long-term sleeping pill. Yeah. But I feel like we have found, what is causing the problem. It's not going to be it wasn't an overnight fix, right. But at least we can begin to repair it. And, with serotonin syndrome, he had decreased good bacteria in the gut, and that could have easily lead to colon cancer. And so hopefully we've put out a significant fire that could have led to other things.
Absolutely. I wish him well and hopes he has an easy wean. He's in good hands. So Dr. Handy, I do have a question from Christine, and then I think this would be a great segue into how the biofeedback machine works.
Sure.
Her question is, let's see, can you share what happens during a biofeedback appointment, when you're doing the assessment, and how you actually measure a person? I think that's kind of the hard concept, is understanding how it's so esoteric, it's based on picking up energy frequencies, which I think as humans, we're like, we don't see it. So is it really happening? So would you mind answering that question and then maybe doing a demo for us?
Absolutely. I think maybe doing them at the same time might be helpful. And, I completely understand. I've been called a witch doctor. I've been said this is voodoo. I think as our, technology has advanced, it is becoming more acceptable and understood. For instance, NASA last July, for the first time, captured Einstein's theory of relativity, what he called spooky science. They were able to capture on film 2 cells, actually 4, interacting without touching each other. And so that's basically, what this is talking about. We can, just like how you can walk into a room and feel the energy, the frequency in the room without seeing anything. I was in a webinar recently, and the doctor that was doing the webinar asked his grandmother, he said, if I told you right now to close your eyes and meet me in the middle of the room, could you do that? And she said, no, there's a chair in the middle of the room. But he was like, no, grandma, you can, the chair doesn't matter. Can you meet me in the middle of the room? And she said, yes. And he was like, how fast can you do that? And she said, immediately, right? So our thoughts, our feelings, one of the best ways that I like to explain it is it's just, it's like prayer, right? That energy, that intention of coming together, and what we can, the greater the energy, the more we can create, the greater the intention, the more that we can create. And so that's really the premise of where this is coming from. Let me share my screen here. Hopefully I can do this right. Let's
And you shared something called that Bruce Lipton talked about, Dr. Handy, about how our thoughts, our feelings, our stories that we tell ourselves can actually affect our cellular health, our organ function, and that's because our energy, our feelings carry a certain energy. And obviously it can contribute to stress that affects our physiology. But could you talk a little bit more about that, and then we'll dive into what you do during an appointment?
Absolutely. So two of my favorite books are Biology of Belief by Bruce Lipton, and then Mind of Matter by Dawson Church. So they very much both are speaking about the same thing. Where do we have an actual example of what they're talking about, that our beliefs can affect our biology? Well, that's in the PAIR project, and it's been going on with Princeton for about 20 years now. And what Princeton found was, in running the PAIR project, is that 95% of our thoughts are negative and repetitive. That negative repetitive thought directly causes an issue with our immune system. It creates fight or flight. I call it when the movie starts playing. And all of us have that movie that starts playing, whether it was a trauma, a traumatic event, something that happened in our life that we just haven't been able to let go of, and that those thoughts start going, and our body doesn't know the event. Our brain doesn't know the event. It will fire the exact same chemical reaction, whether we're just sprained our ankle, we're in danger and we need to get out of the way, or if life is stressful. So again, they do this with athletes all the time. They say, run the race in your head, simulate that chemical reaction, because your brain doesn't know if you're actually just thinking about it or you're actually doing it. Right. So that's exactly what happens here. We've just started doing a new program called Adapt and Thrive in our training sessions, using very much of along Chinese medicine, European medicine, of saying, Chinese medicine says for every disease state, there's an emotion linked to it. And so being able to identify those emotions and challenge that against our most stressed organs, again, to create that overall healing process. And looking at that 50% on both sides. And it was a good reminder to me, because I tend to focus just on the symptoms. Let's go in, let's fix that. And so many times ignore what Princeton has showed us, that 95% of our thoughts are negative and repetitive. And that affects our biology, just like if you sprained your ankle.
Wow. That really encourages me to really look at my thoughts, and I talk about thoughts a lot with my patients as well. And going back to habits, is that there's a thought behind the habit, there's a belief behind the habit or a story. And if we can just be aware of how our thoughts or beliefs are affecting our reality, our physiology, our immune function, nervous system, we can maybe just put a pause, right? Put a pause and shift that thought into a positive thought, or do the healing needed to heal the trauma. So thank you so much for sharing that, Dr. Handy. I think that's a really good reminder for us to check our mind is so powerful. We want to use it for good.
Super powerful. Yes.
Yeah.
I think so many times we forget that piece. And it's been wonderful doing the Adapt and Thrive program with our patients, and seeing, some have gone through that. It hasn't been easy. We stirred the pot and we stirred some things up. But on the other end, it was really good. Some have just been like, I felt like a weight was lifted off, and amazing things that have gone on. Others had very physical symptoms around us stirring that pot. So it's been an amazing learning experience for me.
Great. Thank you so much. We'll have to touch on that a little bit more, but I know that Christine had her question.
Yes, and what that looks like. So
what the heck happens during a visit, Dr. Handy?
For sure. So this would be in a first patient visit, we would ask, there's just some questions on here. We're looking for number values. I don't always fill this out. It's a good way for me to get to know the patient. This is where a patient can really open up and tell me about disease states that have gone on, surgeries, illnesses, things like that. But we can also run it just like I have it here, just with a blank slate. And just say, when I have a patient come in, and let's say that they may want to come in for an overall nutritional overview, I'll fill these in. But if I have a patient come in like today, 80-year-old man, walked in, he had Raynaud syndrome, but he walked in with white hands. And he said, my hands are going numb. I'm fearful based on his age that there's something neurologic. So I just wanted to go to exactly what was the most reactive state. And so when I say that, what that means is if you walked in and you had just cut your hand and you're bleeding, and obviously I can see the blood, I know that you're bleeding, but if I want to know exactly what is the symptom, let's say you're having an allergic reaction. That may be a better thing. And I want to go straight to the root of the cause. I don't want to see this overall, I don't need to see the overall picture. I need to see what's causing the problem. I will not fill this in, okay? Because that's going to assess just right here, right now, versus things like what Dr. Tang was talking about. If I do want to go back in the past and I want to see, maybe what some things that had gone on that the body is still working on and hasn't physically healed. So we can run this both ways. So right now I'm going to leave it blank. I'm running myself. What we do is in creating a digital file, we would ask these questions and then we would go in and create a digital file by identifying information that's not easily duplicated. So again, this is where people are like, oh, this is like, too metaphysical or something like that. Oh, no, it's just so that you don't get confused with somebody else. So first and last name, date of birth, the city of birth, and one thing that you can't see because we've got a whole patient name just for HIPAA violation. I didn't want to show the other screen, but we would also ask the time of birth. If you don't know, the system will calculate it. We just need to have it for that digital file. And then it will show, if we're using the United States, it's going to show a map, and we're going to double click on the state of birth. So that creates your digital file. That brings us back to this screen. And I'm going to go to here. There we go. And it's telling me that I have a biorhythm that's a little off. I'm not going to treat that right now, but I could. So I'm just going to exit out of that. Hopefully.
Okay, at this point, are you hooked up to the machine? Not right
I'm
now.
sorry. Yes.
Okay.
So you would be. And I don't know see this, but there's going to be an amplification device right here, and that's where, oh, it's getting mad at me that I'm moving this, so I'm going to have to restart it. And then you can see the ports that are coming in right here. So that's where you would have the electrodes that are hooked up.
Oh, so, okay. Hold on a second. Can you stop sharing your screen so we can see where the ports are at?
Let me see.
We want to be able to see you.
For some reason, you know what? My screen is frozen. Let's see here. Stop. Okay, so let's do it this way. So can you see on here? This would be where we would be plugging in the ports, and we would have the amplification device right here. Okay, so really mad at me that I did that and I moved it all around. So let me go down here for just 1 second and see if I can get this up and going. Okay. So is everybody seeing this? Am I able to?
No, not yet.
Not sure. Okay. Let's go back to here, share screen. Okay, so we're right here. So sorry. Let's see if I can mute that. Okay, so what it's asking me right now is to create the, to lock in on the patient. So we're gonna calibrate, and that's where it told me that I had a communication error, so it's gonna make me go back. And for some reason, it keeps freezing when I'm sharing the screen.
Oh, okay. If it's
stop for 1 second and go back, and let me just get it back up to this point and see if it will let me. Hold on. Yeah, it works fine as long as I'm not sharing the screen.
Okay, Tar.
Okay. Let's try one more time here.
If not, you can just tell us about it. And maybe if you want to send like a sample report or something, we can email everybody.
Oh, yep, I can definitely do that. Hold on 1 second. Let me just see if I can get this up. Do you want to destroy the last patient? All these wonderful little sounds that it's doing. Come on.
This is a good time to put more questions in the chat if you'd like, and then we're going to open it up pretty soon.
Yeah, I can absolutely answer questions while, do you know what? So while I'm doing this, yes, if anybody has questions, I am happy to answer them.
Yeah, why don't we open it up to everybody? You can unmute yourself. And if you have a burning question, please share. Does anybody have a question or a comment or,
Danny.
Hi, Danny.
Yeah.
Yes.
Joqueta, I have a question about the new ones that you, and I might have missed it when you were saying it. Oh, are you saying that new one that you're doing, is it more interactive where you're talking about feelings as well? Yeah.
Yeah. So it's based on 8 sessions. The first 2 are getting the body to communicate. So, you know, if sometimes, like I have patients come in quite often and I'll say, oh, are you having low back pain? No. Really? Are you sure? And, you know, are you feeling extra tired? No, I'm fine. So sometimes, and I'm guilty of this too, you know, we just get in our groove and we feel a little something, but we're just able to brush it off. And sometimes that's not to our best interest. And so it's getting the body to communicate. The third session is what's called POP, pointing out the pain. And that's where we identify the 2 most stressed organs. What's different about this program is it takes the practitioner out of the loop. So instead of me saying, oh, look at that, your limbic system is reactive, you're in a fight or flight response, that must be because your stomach isn't happy. It's like, no, you don't need to make those connections. Let's just go with what is being shown before you in a specific, very structured way. And so then from those 2 stressed organs, we challenge those against emotions. And then that's where the patient becomes involved. And in revealing those emotions, working with them, and we do that over the course of 3 sessions, and then we go back into a balancing piece.
So the very first 2 are like testing and the rest are like training, or no?
It's all training. It's just getting the organs, getting that body in real communication before we say, where are those most stressed organs? Okay, now tell us where the stressed organs are.
Yeah, very interesting.
Yeah,
Dawn had to have a question. Why 8 sessions? Does it just take that long to assess and retrain the nervous system?
Very good question. Actually, in some, it's been, we have an 18-year-old right now it's 15 sessions that we're on. Sometimes when you stir the pot in that pot piece, there's many layers. He was, since he was 8 years old, when I met him at 8 years old, he was on 4 different psychotropic drugs. And I had a very well-known Orange County psychiatrist tell me, you will never get him off drugs. He was off drugs in 6 months. But he has continued to have a lot of anger. He can go from 0 to 100 in a minute. And it's not physical, it's more, yelling and screaming and I'm not doing this. And so it's really affected him socially, and it's kind of out of his control. And his mom, when we did it, when we ran this the first time, she was like, whoa, no, I don't want to be a part of this. It got much worse. And then as we moved into one of the second emotion, what we call pop sessions, she reported back, she's like, I never remember him being this calm. She's like, I never remember enjoying him this much. And so we've continued just to stay with those, it's session 3, 4, and 5, and repeat it over and over. So even though there's 8 sessions, it doesn't mean that you have to go in order. And you really run it always as an individual.
Okay, right. That's what Dawn was wondering. One of the questions was, it depends on the person. And I'm not quite connecting the pieces. This is a program that you use that identifies trauma, imbalances in the nervous system, and it allows the person to look at their trauma or their story or their emotional state that's being buried underneath all these layers, and be able to heal their nervous system.
Exactly. Very much like, the PAIR project. So those repetitive negative thoughts that lead to a disease state, or very much the European model, 50% we need to work on the emotions, 50% we need to work on the disease state. So that's really how this is divided up.
Okay, got it. I was going to ask you, what do you commonly see as causes of imbalances? So I jotted down as a fungal infections, nutrient deficiencies, hormone imbalances, emotional trauma. What do you normally see as is it all of it, or do you see like a theme in our Western society, especially?
I think I'm learning more now. With 4 months ago, I would have answered that question, absolutely toxicity. But I think it was my own negligence as a practitioner. I wasn't comfortable looking at the emotional piece. I'm not qualified. I'm not a psychologist. I'm not a psychiatrist. Why did I work so long with autistic children, and I still work with them? Because I could feel their pain. And I could many times sense where it was coming from. I don't think I ever opened myself up to that as an adult. I think I shut it off. In working with adults, I think I saw it as almost too painful. As a child, I'm like, okay, I can fix this. And a lot of times, the older we get, the more baggage we can bring. And so it made me very uncomfortable as, I'm not going to be able to help. It's going to be too much for me to handle or what to do with. So as I've worked with this tool, over the past 3 to 4 months, I've become more comfortable again, just in having, I think, a structure to address it and seeing how it is helping people. I still don't feel comfortable just diving in and saying, tell me your feelings. Let's get into this. Where did this come from? Because again, I'm not qualified to do that. But I do see this as a wonderful tool. There's an adjunct to it called emotional insight. And as I've been working with this, just like today, I had a female 50-plus-year-old patient come in, and she was hurting. She came in for a physical reason, but there was so much emotional pieces. And as I've worked with this, I've become more aware, not just putting up that wall of, "Ooh, I don't want to go there." And so I think, I don't know if it's COVID, if it's 2020, if it's just me being more open. But I definitely see the emotional parts being a huge piece of it. When I look at my own mother, she died of breast cancer that metastasized to the bone 20 years ago. And she was I saw her as such a faith-filled, strong woman. Me telling my kids there's a solution to every problem, I tell them that because she told me that. And after she passed away, and I looked at her journals, I couldn't even continue reading them because there was so much fear. She was afraid of everything. And she did a wonderful job of masking it, and that just, farm mentality of, just suck it up and get through it. But I know, fear is it, where do we hold fear and anger? That's in the liver, and just in the disease state that developed, because it definitely wasn't, her diet was wonderful, and supplementation and exercise and all the pieces that, even people, when she got sick, they're like, her of all people, I wouldn't think would be the one that would get cancer, just in her nutritional practices. But then when I looked at those journals and was like, okay, this is what was really the root of the problem, I would have approached it with her so much differently.
Mm. Yeah, I think it's really beautiful that as you open yourself up, open your heart up to looking at the emotional body within yourself and within your family lineage. You were able to also hold space for your clients, your patients, to be able to do the same. And it is helpful to have tools to be able to support, patients who are unraveling their trauma. And a psychotherapist is really helpful. And it sounds like a program you use too is a great way for patients to just begin to, see see what's going on, and then ask them if they're willing to look at it and heal their emotional state. Yeah, that's wonderful, because I find that that's probably one of the more challenging pieces. Is it's easy to take a supplement. I think it can be pretty easy to change your diet for most people, exercise, but for people to look at their stuff, I think that can be very challenging. So it's wonderful that you were able to provide a loving, supportive space, a healing space for that, with a tool that helps people shift. So thank you, Dr. Handy. I know that we have, I don't know if your program's working, but if you want to if it's not.
We can try it again. The screen's
Right,
up. Let's give it a try and see
I
if
really
it'll let us share this.
to get her question answered.
Okay, let's see here.
And we have, well, what we do about maybe 5 to 10 more minutes. I know some of you have to go, but thank you for sticking it out. This is really interesting. I'm like, I have so many more questions.
So this would just be what, after we've run the test, you didn't get to see that screen because it kind of blipped out, but this would be what we call the main matrix. So when I was talking about those reactive numbers, that's what this is. So red is, like I described, you're bleeding. It's what's happening right now. So if you notice, like at my highest red line, the most reactive thing that I have is sinus. I totally agree, because of air quality. Yeah, it's been going on for about 3 days, as long as the fires have been going on. The purple is one standard deviation better in terms of health. Whoops, we went too far. The yellow, I've got lots of green. That's good. Green is my highest state of health. That's what I'm resistive to. But this green becomes a very helpful area of, let's say that somebody comes in and, well, my husband, that's a perfect example. He loves to challenge me on this program all the time. So he had a patient that came in and he said, I want you to tell me what's wrong with her. So I'm like, okay, so I'm looking at the red, I'm thinking it's something right now. And I'm like, I don't know, she's got some heart problems, I'm not sure. And he's like, no, she had a stroke. And I said, well, how long ago did you have the stroke? And she said, 7 months ago. So she's not bleeding right now, right? So I went up here and sure enough, it said trans-ischemic attack, TIA, and it was in the 140s. So her body had not healed from the stroke. And that's why she had come to see my husband. So we can use this green area to track past medical history. And this is also a place where the body a lot of energy can be spent. If you're still working on things in the past, and you've got new things that every day, all of us have new things that, fires in Orange County cause sinus issue. We have things that impact us every single day, and that's where we want our body to go and put out those fires. But if you've got a lot of stuff that hasn't been dealt with, then you're going to have that divided energy, and then that's when bricks in the wall can build up. So this is the highest state of health, and I'm all good. I don't have anything over 100, so my body's dealing with what's coming in. The yellow is then 1 standard deviation lower. The purple, where's my purple? 2 standard deviations lower, and the red is what's most reactive. So when you come in to see me, what I'm really concerned about is, what is this red? What is most reactive? Now, one thing that's important, these are just frequency holders. Let me see if that'll let me do this. So just because it says sinus doesn't mean that that's sinus at face value, okay? It can mean it picked up on stress in my sinus cavities that was most like this, okay? So another good example of that is, I have a very good friend who's a nurse, and she came in and she was very upset at me, and she was like, you didn't tell me that I have colon cancer. I'm like, you don't have colon cancer. She's like, yes, I went to another biofeedback practitioner in Irvine, and they told me that I have colon cancer. Well, I was privy to her personal life, and I knew that she was going through a lot of marital issues. And I said, your body's acting like you have colon cancer because of the stress that you're under. I'm like, you're a nurse, go check it out. I'm like, let's see who's right here. And so sure enough, she didn't have colon cancer, but her body was under so much stress that it was presenting. She had a frequency holder at a very high level that she had cancer. So let me see if this will run it. So I'm going to bring it, drop over here, and I'm going to say, do I actually have sinus issues? And it's going to muscles, it's going in here. So yeah, I probably do. I have some tension in this area, and it's going to go to what is, again, that Chinese medicine. For every disease state, there's an emotion linked to it. It probably goes back to my husband. Anyway, with this, in just identifying the two sides. So yes, I probably do have some sinus issues. How can we look at other groups of information, like what I was talking about, that I really enjoyed doing with autistic children? We can go to look at those neurotransmitters and see how those are coming in. We can challenge that against emotions. So over here, if I had something over 100, and we can see, even though it brought up aggression linked to sinus conditions, it's coming in at 93. So that one's okay. Looks like I have some suppressed anger around what's coming up in the neurotransmission. So we can look at both of those. Again, we're just chemical electrical beings. So this is how I can go in and look at different groups of information. It's showing in the brain scan different areas of inflammation. Definitely true. So this can also be seen, what areas are reactive within the brain. And reactive doesn't necessarily mean a bad thing. If we go to our, I only have part of my, see. So if we look at vertebrae, which is another area, all I'm doing right here is just searching within that whole matrix that I just showed you. I'm just telling the program to categorize, group it, let me pull and look at it. So I have scoliosis. And so one of the things that creates inflammation in those brain centers that just came up is very much it comes from my back and from my neck. So we can see here, true like cranial sacral, the sacrum is out, and some areas in the cervical vertebrae and my neck. And for sure, one of the most reactive areas that I can see just by color and by number is my shoulders, T2, which is very true. So when my husband adjusts somebody, when I was saying it, just because it's reactive doesn't mean it's a bad thing, is if my husband has seen someone first and then they come in, it's like going to the gym. You just lifted a 100-pound weight, that bicep's going to be reactive. If he's just adjusted on the spine, those vertebrae are going to be reactive. But how can I also track it? What I saw when I went to my brain scan was I saw areas of inflammation in my brain. Where do I know that's coming from? That's coming from my spine. So in putting the pieces of the puzzle together, we can group in many different ways. This is one of my favorite screens. What's our highest risk factor? So right here, this is telling me that my toxic level is very low. Alarm means that your toxic level is low, so your body immediately alarms to what's not good for you. That's where you want your toxic level. As we become a little bit more toxic, the body begins to adapt. It's not as accurate at responding. And when you're in a full-blown disease state, your body's exhausted and it's like, that's it, I give up, and it's not responding. So what is one of my highest risk factors? Sugar regulation. Probably that chocolate chip cookie that I ate today. And so
well, the machine doesn't lie, does it, Dr. Handy?
It doesn't. No. So actually, had 2 chocolate chip cookies. So what I'm just asking the system, out of everything that it could have chosen, why did it choose sugar regulation? And so it's telling me right here that I need to get some toxins out of, probably that white sugar, out of my bowel. Sorry for the noise. And again, that sinus piece is playing into it. These are the top 5 reasons of why it chose sugar regulation. This is also, if we back into it, may not be those chocolate chip cookies. It's saying that the thyroid isn't supported. And so we know that that can very much affect our sugar regulation just from a hormone standpoint. And that's directly linked to my stomach. So these are just, I can keep going forever, so you guys can just tell me to stop at any time, but hopefully this gives you an idea. These are all other ways that I can go in and look at information. On the flip side, these are all ways that we can go in and train the body as well, in saying we can reverse this and say, okay, I want, sinuses are the most stressed area. So I want to send frequency into those sinuses. So I can go do treatment. I can either directly treat right here, as it says, because I have sinus loaded in, or I can go to one of the other areas. Maybe I want to look at, maybe sinuses are affecting the teeth. So I want to go in and actually run some training around certain areas where I'm seeing inflammation from sinuses. I can go in and directly treat those sinus cavities.
And Dr. Handy, how are you exactly treating the sinuses? Are you sending a different frequency? How does that work?
So that is all in the system. So let's say right here, just because we have it up, lymphatic. So I want to send that frequency. I want to stimulate the lymphatic system to drain. Sorry, that's what's going to happen right here. So that, and in just a minute, it's going to give me a feedback. So what it just told me is that on this particular program, that what you want your tissue reaction to be is at least 10% lower than the repair. So I still have too much inflammation and some underlying infection in the lymphatic system for it to be considered. And when we say repaired, that just means that we stimulated it for drainage. That does not, and that the tissue responded. So again, think of it like the gym. I'm not saying that I just healed my lymphatic system. If I want to have a bigger bicep, I'm going to go into the gym and I'm going to lift that weight. And I walk out and I'm like, okay, that biceps, that it's a little bit more toned. Is it where I want it? No. So I'm going to have to go back the next day or 2 days later and lift that weight again. And if I want that bicep to keep getting bigger, then I'm going to have to go up in weight, and I might have to go up in repetition. So when we say, oh, look, these tissues, the response was perfect, you're all good. No, that just means that the tissues responded. I gave a push, the tissues responded back, and it was a positive response. And the more positive responses that we get over time, the greater the changes in the overall body.
So, I mean, it seems like this change, this positive response, this frequency that we're sending to the lymphatic system would be the same as shifting your thought. So if you decide to change the thought of I suck at something, I'm bad at math. That's mine. and then I say, you know what? I do my best at math. I do what I can, and it has nothing to do with my worth. Is that what you're saying? Is that frequency of that energy shift, that energy thought will allow my nervous system to not feel so unworthy about my math skills?
Exactly.
Okay.
Or just like here where it's talking about where's my highest red line on sinuses. So what do I know is going to be affected is, within there is congestion, right? So that's going to affect my lymphatic system.
Yes.
So in helping my sinuses feel better, if, I go get in the sauna, if I stimulate drainage, I'm going to have clearer sinuses. Yeah. So again, those puzzle pieces, the stacking method of creating that optimal state within the body.
Okay. And it sounds like what you also may suggest is, hey, you may be a saline nasal rinse is showing up as.
Absolutely. This should I never use this as a standalone tool. And I guess I'm finding out that I'm one of the few practitioners that do that. It's just not the way I've ever treated. It's, maybe I'm just not loyal to one thing. I'm not sure, but the way I look at it is, the more frequencies or the more things that we can direct at the same place, the greater the change. Everybody brings something to the table, right? So if we're working with a team of doctors, if it's education, different teachers, everybody brings something a talent to the table. The more talents that we have, the greater the change is going to be. I certainly don't know very much. And so constantly looking and saying, what else? What else? How else can we help? And so supplementation is a tool, biofeedback is a tool, infrared sauna, acupuncture, all of those pieces are tools that can direct us in the same direction.
Wow. Wonderful. I had a question about how does biofeedback integrate with naturopathic medicine and acupuncture and, diet and movement and psychotherapy we talked about. It sounds like, going back to the village mentality is like we're providing a very big toolbox.
Absolutely.
To help support the mind, body, and spirit. And yes. The biofeedback assessment tool is a way to get to the root faster. That's what it sounds like to me. Like you're able to get to the causes, the contributing factors much more quickly and efficiently through this method. So I do want to share
referrals.
Yeah, so great. I love this. And I do want to share just really quick. I know we need to wrap it up at 6:45, but when I went to go see Dr. Handy, I had no expectations. I was just like, I want to know what you do for patients. What is your biofeedback, tool all about? And so just real quickly about my history is that when I wanted to go into the medical field, I had to get a TB test to volunteer at the hospital. So I'm like, oh, I want to, do something in medicine, but I'm not sure what. So I got a TB test. I was positive, meaning I had been exposed, but I had, my immune system took care of it. So what the public health department does is say, you need to be on 3 months of an antibiotic. And I was 18. I was like, okay, sure. So unfortunately, that antibiotic wrecked my microbiome, my good flora. It allowed for, and probably a number of other things, but it allowed candida to grow aggressively in my body. And I didn't know, I was so tired. I was like, had, and candida infections all the time, had gut issues. And I've been working on it for a long time. And once in a while, when I'm stressed, or maybe I eat, some sugar, it flares up. So when she did this assessment, the biofeedback tool, she said, you have candida. And I'm like, are you kidding me? I thought I took care of it. But I never told her I had candida. I didn't tell her I took antibiotics. She just took my general information. So after that, I was like, oh my gosh, I'm a total believer, because it picked up the frequency of candida. So it encouraged me to say, okay, it's something I need to continue working on. So I do want to thank you for that, Dr. Haney. I don't know if maybe that specific, very simple example helps some of our, attendees here today who's never tried biofeedback before. And I hadn't either, but I was like, let me just see what it's all about. And I was floored. I was floored that she was able to pick up on so many different things that I wasn't even aware of, or I knew was an issue in the past and I still needed to work on. So that's what I had alluded to before. So I wanted to ask just one last question, or maybe two more questions, is the books that you would recommend or resources you'd recommend to find out more about biofeedback. What would you say those are? And I'll put them in the chat for everybody.
Definitely Biology of Belief by Bruce Lipton, and Mind to Matter.
Mind to Matter?
Yes, by Dawson Church. Looking up the PEAR project. That's wonderful information, because it's all on frequency. Just real fast on what they found on that project, a neat little piece that came from it. They were doing the project during 9/11. And they just have an algorithm that's running, and they saw this huge spike 2 hours before the first plane hit the World Trade Center. And so they began looking at it, and they're like, oh, dude, is this what precognition, what created this huge spike? And when they started investigating, and some of the first reports that came out was that there was like 8,000 people in the towers. Well, that number came from how many people were supposed to be there at around 8 a.m. that day. But the actual number was less than 2,000. And when they started investigating and finding out, well, you were supposed to be there, why weren't you? And there were celebrities, there was Fergie, there was, all the people. And it had happened within less than 24 hours of reasons why they weren't there. A delayed flight, missed a cab, overslept. And it just kind of went on and on and on. And when they looked at it and said, what was this? It was the frequency of love. And so the saying love conquers all, it truly was. Even if you look at the terrorists on the planes, they were on a suicide mission. And so the frequencies that were just being shared and that were going out 2 hours before, for sure 2 hours before that happened, was when the greatest spike was. But just in saying, how can we connect? We connect through frequency, and we especially connect through the frequency of love.
Oh, I love that so much. It's so true. Love really does heal. And if we can open our heart to that, amazing things can happen. Thank you so much, Dr. Handy. Can you tell us the PEAR project? How do you spell that? Is it?
It's just each, I'm not sure what the whole thing is.
P-A-R-E.
It's P-E-A-R, but it's P period, E period, A period, R period.
Okay, got it.
Yeah.
I want to type that in so everybody knows. Look that up. That sounds extremely interesting. I will have to do that too. And then last but not least is You are offering a $20 off promotion for new patients that are wanting to try an initial biofeedback assessment and visit.
Absolutely.
So thank you for
Yes.
doing that. I hope everyone takes advantage of that. And if we wanted more information, a patient wanted more information or to schedule an appointment, what's the best way to get a hold of you?
Just in through our Handy Wellness website, handywellness.com. And you can, all the information on how to contact our office is there. And just be sure and let Karen Robinette is our office manager. She's my right arm. And so just be sure and let her know that you were a part of this webinar, and so that you get the discount.
Wonderful. Thank you so much. That's handywellness.com. And I'm sorry if anybody else had any last burning questions. We have maybe a minute or two. Does anybody want to ask anything else? No? Okay, wonderful. I wanted to I don't know if you all saw in the chat, but Danny did share a link called Creating a Safe Space with regard to energy medicine. So please check that out. Thank you everyone for being here and joining us. Thank you, Dr. Handy. You're a wealth of information, and we're just so happy to have you as a colleague. Thank you for all the work that you do. And it sounds like you have so many more amazing tools. So if you want to touch base with her, please reach out to her office and connect with her.
Thank you all for being here. Thank you, Dr. Tang. It was such a pleasure and an honor.
Absolutely. Take care, everyone. Bye-bye.
Good night.
Let me stop the recording. Bye, everyone.